Good design is good business. Our focus today, the Planned Parenthood Clinic on West MacArthur Boulevard in Oakland, California, designed by Fougeron Architecture. To begin our visit, we asked Diane Harrison, President and CEO of Planned Parenthood Golden Gate, to tell us what the overarching design goal was for the space.
It was a goal to achieve a clinic site that I would want to go to or any other woman would want to go to. And just because the clinic happens to be located in a medically underserved community didn't mean that we needed to have a design that was like the public health department. Why?
We then asked Anne Fougeron how she began to formulate a plan to realize the client's vision.
When you talk to the client about their mission, you try to understand how that mission can be realized in the architecture. And I felt from the beginning that Diane and I had the same mission, which was really to sort of create a non-institutional kind of quality to a space to serve really sort of underprivileged women.
And what are some of the design steps you took to avoid this institutional feel?
One, this desire to have a really kind of fun, I'd say joyful space that you walk in, and it's interesting enough to look at that you notice from the beginning.
You had the added challenge, Anne, of achieving this joyful feel with a very tight budget. Talk about some of the strategies you used to execute this design with limited funds.
Color is a great thing. It's cheap. It's not much more expensive to paint a wall red than it is to paint it white. You just have to decide where the red goes or where the blue goes. So for us, the combination of natural light and color how color can change even over the day and the amount of sunshine you have in a room really becomes a way for us to create this very diverse looking space, even though really all we've done is paint a couple of surfaces colors. And so we find things like that we know are not very expensive and are pretty easy to bring into a space, and we use them abundantly, I have to say.
What was another key design decision that would help Planned Parenthood meet its business objectives?
It was also to create a space for them that would live well over time, because I understand that with Planned Parenthood, one of the issues, which is an issue for a lot of nonprofits, is that they can find the initial money with difficulty to develop a site, but then they have very little cash afterwards to maintain it.
And what are the design decisions that lead to a low-maintenance space?
We focus on the use of materials a lot, and in a way it's interesting to note that the longevity has a lot to do with sort of sustainable design aspects. So, we use a lot of natural materials, cork, for example, which we started using in clinics, I'd say about, 12 years ago, and has been a mainstay for us because it needs absolutely no maintenance and works beautifully and is sustainable to begin with. It's thinking about how people approach architecture and the places where it gets the most heavy use. What do people, when you stand by a window and you check in, clearly there's a lot of use of that surface, and how do you protect that surface and not making it out of sheetrock and having steel edges so that the edges don't get ruined. Then the same thing in the corridor. So it's really sort of considering every single surface individually and starting to think about not just what looks good, but also what's going to keep that surface from what's going to keep it looking good for the next 5 years.
What are some of the lessons you've learned from this project that you've been able to apply to other designs?
I think some of the things we learned is also the importance of sometimes having nothing in a space like the courtyard, and this idea that something that's the absence of program in a way is sometimes as important as program, and we certainly encourage other clients now to think about that.